My name's Kayla. I'm going to perform skills video head to toe assessment. So first I want to knock on the patient's door, enter the room, and provide any privacy. I'm going to perform hand hygiene and apply clean gloves. I'm going to pretend that I have gloves because I don't have any. I also don't have my badge, but I'd be wearing my badge with my name on it. My hair is slicked back out of my face. I don't have any dangling jewelry on. I have tennis shoes on and the proper attire. So I introduce myself to my patient first. My name's Kayla. I'm going to be your nurse today, and can I have your name and date of birth?
Giovanni Vera, 12345.
Okay, I check their wristband and then let them know that I'm going to be performing a head to toe assessment. Is that okay with you?
Yes.
Okay, so we got their consent. Next, I've already assessed their vital signs. So blood pressure is 132/60, heart rate is 67, pulse ox is 99% on room air, and respirations are 18. So now, are you having any pain from 1 to 10?
No.
So 0, great. Okay, so I'm gonna go ahead and get started. I'm gonna start with your hair. So I wanna take a look at your hair, and it seems that hair is evenly distributed. There's no thinning, there's no skin lesions or abrasions in the scalp. I'm gonna go ahead and take a look at your ears now. And it appears that the ears are symmetrical. There's no drainage. There's no skin discoloration. The skin color matches the skin on the face. And I'll go ahead and take a look at your eyes now. So I'm gonna shine a pen light. Don't look directly at it. Okay, other eye. Okay, and then I just want you to follow my pen. Okay, my patient's pupils are equal, round, and reactive to light and accommodation. So I'm going to take a look now at your nose. Nose appears some intact. Nasal mucosa is pink and moist. There's no skin lesions or abrasions, no drainage, no bleeding. Septum is midline. Okay, awesome, thank you. Next thing I want to do is take a look at his lips. So I'm going to kind of palpate. And they feel soft, no skin discoloration, no abrasions. Go ahead and open your mouth and say ah. Okay. Teeth are intact. There's no missing teeth. Oral cavity and buccal mucosa are pink and moist. No abrasions or skin lesions. Is there any pain in your gums?
Nope.
Okay, I'm gonna go ahead and just kind of lift and take a look. And then your bottoms. Okay. Gums are pink and moist, no skin lesions or abrasions. Okay, next thing I want to do is check for hydration status. So I'll do that by pinching. I'm going to pinch your neck. Okay, great. So skin trigger is non-tinting. So next thing I want to do is check the range of motion in your neck. So I'll have you kind of go from side to side and then forward and back. Okay, my patient has full range of motion in his neck. So I'm going to take a look at your skin. So go ahead and pull out, and your legs as well. Okay, my patient's skin feels dry. There's no skin lesions or abrasions. There is some tattoos, but no bruising or swelling. Next thing I want to do is listen to the lungs. So just go ahead and breathe normally, okay? Okay, lungs, oh, I'm sorry, we'll do the back too. Same thing, breathe normally. Okay, so lung sounds are clear in all lobes. My patient doesn't seem to be using any accessory muscles. No distress as he's breathing. Next thing I'll listen to is the heart. Okay, my patient's heart rate and rhythm is regular. So I'm gonna check capillary refill, so I'm just gonna have you put your arms out and I'm just gonna pinch at your fingertips. Okay, thank you, you can relax. So patient's capillary refill in the upper extremities are less than 3 seconds. So I'll do the same thing to your feet. Okay, so my patient's capillary refill in his lower extremities is less than 3 seconds. So next thing I want to do is inspect your abdomen. So if you can lie in a sitting or lying position. So inspecting my patient's abdomen is non-distended, sorry, and then I'm going to go ahead and listen. Okay, great. You can lie back in a sitting position. So my patient's bowel sounds are active in all 4 quadrants. But when was your last bowel movement?
This morning.
Okay, do you have any trouble going to the bathroom? Okay,
no.
Awesome. So next thing I want to do is test your range of motion. So first thing, we'll do the arms. So go ahead and just kind of, circle your arms around. And then I'll have you go like this, and I'm going to push and don't let me.
Mm-hmm.
Okay, you can relax. So my patient's upper extremities has full range of motion and strength. I'm going to do your legs, so I'll have one leg up first, then the other. And then I'm going to push down and don't let me.
Mm-hmm.
Okay, and keep them up. We're going to test your ankles, so I'm going to push down and don't let me. Okay, and then if you can kind of move them from side to side and around. Okay, awesome, you can relax. So my patient has full range of motion and strength in his lower extremities. So next thing I want to do is check your pulse. So go ahead and put your arms out like this. I'm going to check the radial pulse. Okay, so my patient's radial pulse is +2 bilaterally. And then, upper extremities is +2 bilaterally. You can put your arms down. We'll do the legs. So go ahead and I'm going to check the dorsalis pedal pulse. Okay, you can relax. So patient's lower extremities is at +2 bilaterally. Next thing I want you to do is go ahead and stand up for me. I'm going to check your back. So I'll have you, I'm going to push on your chest and don't let me.
Mm-hmm.
Okay, and then if you can bend over and touch your toes. Okay, so full range of motion and strength in my patient's back. So go ahead and take a seat. Actually, before you sit down, walk to the chair and turn around and come back. Okay, you can sit down. So my patient appears to have a steady gait and a well-balanced coordination. Next thing I want to do, I know I already asked you, but can you tell me your name and date of birth again?
Giovanni Vera, 12345.
Okay, and do you know where you are?
Yes.
Where are you?
I am in the hospital.
Okay, and okay, so based on the Glasgow Coma scale, I would rate my patient at a 15. He's alert and oriented ×3, and that means his eye, verbal, and motor response is intact. And before I exit the room, I do want to provide my patient with some education if needed. I'm going to perform hand hygiene and remove my gloves.